I am going to share with you guys some news about my life that's been going on. I was hoping that at my news around this time of the year would have been about my book, but unfortunately, life had different plans for me. So about a month ago, I was diagnosed with breast cancer. And during that time, my mom had breast cancer around 48. So I've been getting screened for breast cancer since 38, every 6 months or so. And during that time, I was getting MRIs and mammograms. And so the last MRI was about 8 months ago because I got a little behind. And during that time, the MRI was normal. I had one time seen an abnormality, which they imaged a little further with an ultrasound, and they weren't concerned. And so we continued screening. So this happened. They saw an abnormality and they said, come on back. And like most of the time it's nothing. So I said, okay, I'll come back. And I came back. And then when they did the mammogram, I saw the picture of the mammogram on the side of the wall, where they were like looking at it. And I said, oh, that looks real. Like as a surgeon, as someone who looks at imaging all the time, I said, okay, that looks like something. And then they did the ultrasound. And at the ultrasound, first it looked like a cyst, which is basically like a fluid-filled sac. But then I saw sort of like an irregular border and some thickness of the cyst wall. And I said, oh no, that looks like something real too. So then they said, okay, we want you to come back for a biopsy. So I said, okay, well, you never know. So came back for the biopsy. And the interventional radiologist who did it, or the radiologist who did it, I don't think he was interventional, but he was great. Like he was super kind. He walked me through everything. It was not particularly painful. They numb your area where you're getting the biopsy. Luckily, they could do it under ultrasound because sometimes it's a little bit more difficult with MRI, which I've heard that some people have to get because you can't see it well on ultrasound or you can't access it well on ultrasound. So it was in an easy location. They numbed the area. They did the biopsy. And it was interesting. He told me that like when they do the biopsy, they try to get at least 2 specimens that float to the bottom of the cup. And this is because the breast tissue is all fat. And so fat floats. And so they wanted to make sure they got some mass tissue. And he said, that doesn't mean it's cancer, but we just want to make sure it gets to the bottom of the cup. And I said, okay. And so then the next day I got a phone call from my primary care doctor who was actually like in the Netherlands. Like he's like with the Olympic volleyball team in the Netherlands and like calling me in the middle of the night. And so I immediately knew, like you pick up the phone and he's got that like serious voice and told me, right? And so I was like, okay. So he told me the pathology, which was invasive carcinoma. I'll tell you a little more about that as we go. But he tells me that that's, this is the pathology. And so I start like obviously researching as a physician, like, okay, what does this mean? At that time, they told me it was what's called invasive lobular carcinoma. So I'm searching all of this. I immediately, because the one thing I will say is being a physician, I have lots of connections and I've trained with a lot of other surgeons. So I called my good friend who is a breast surgeon at MD Anderson, which is a big cancer hospital. And she was actually happened to be at a conference for breast surgeons. So she reached out to her friend who was there, who works here at City of Hope, who got me in very quickly, which was, I'm so grateful. So grateful. And so, I did some research about it. It at the time was like 0.7 to 1 centimeter in size. And essentially, went to the breast surgeon, talked about all the options, and essentially decided at that point on getting a lumpectomy, which I'm having surgery tomorrow, which will be followed by radiation, as long as everything, there's no positive surgical margin. So the other twist comes about 2 days later after I got the biopsy results, or maybe I think it was 2 days later. My husband has a colonoscopy and he's 44. So colonoscopy screening starts at age 45. But what happened was when we went to our primary care, and we go together, right? We go to the same primary care doctor. I make all the appointments. We go together, we get our blood work together. And so he at that time was found to be anemic, meaning his blood count was low. And he was like, oh, is that a big deal? And I said, look, guys should never be anemic, right? Women menstruate, they lose blood, so sometimes they are anemic. But for guys, it's not normal to be anemic. Now, he had not seen bleeding from anywhere. So usually if you're having bleeding in the GI tract, you might see dark tarry stools. You might see blood in the urine. None of that. He didn't see any of that. His stools were completely normal. They were normal caliber. And for all of you to know, if you see abnormalities in your stool, whether it's blood in the urine, whether the caliber changes, like it's thinner or thicker, you absolutely should go talk to your doctor and get a colonoscopy, talk to GI doctor, because that could be a sign of something. And we're seeing colon cancer in younger people. You guys probably saw James Vanderbeek died of advanced colon cancer. I think he was 38 or 40. And I think it was 48. But this is a serious issue, and we're seeing more and more of it happening in younger people. So because of that, and my husband also had really bad GERD, like he had really bad GERD that he would often skip dinner because he had GERD in the middle of the night, and he would have issues with that. So because of that, I said, look, you need to get evaluated. We were going to do an upper GI. And because he was almost 45, we also added on the colonoscopy. And let me tell you, it was an afterthought, right? I didn't think we were going to find a tumor. I was actually more worried about his esophagus, because when you have GERD, that acid goes up into your esophagus. And in medical school, you do learn that when you have chronic GERD and you don't treat it, you can get abnormalities in the esophagus. You can even get cancers in the esophagus. So I was really worried about that. But we went, he had his colonoscopy. I waited in the waiting room. It took longer than expected, but I said, okay, maybe they found some polyps, which is pretty common in colonoscopy. And that's the reason to get colonoscopies, because when you get colonoscopies, if you find a polyp, that's almost like if that polyp continued to grow, it would turn into a cancer. And so removing those polyps is actually preventative. And so I was like, okay, well, that's fine. So I get there, and the GI doctor, who was excellent, shows me the report and shows me the picture and tells me, hey, I saw this tumor. And I see the picture, and I've seen many tumors in my life inside bladders and in other organs. And I was sure it was a tumor. And he said, look, this looks, and he didn't sugarcoat it. He said, look, this looks concerning. I highly suspect this is cancer. And it was pretty big. At least that's what he said. Now, so I was worried, obviously. Fortunately, again, I was able to get my husband in to see a colorectal surgeon pretty quickly. It did come back colorectal cancer, what's called adenocarcinoma. And he just had surgery about a little over a week ago. He's doing well from a surgical standpoint. But the reason I share this with all of you is not because, of course, I appreciate your well wishes, and I really do. But I'll be okay. Like whatever happens, I have support. I have my parents. I have so many friends and family who are willing to help me. But more than that, I really want to speak to all of you about getting screened. It is so, so important. Like a lot of women will skip mammograms because they're uncomfortable. Like they smush your breast like a pancake, right? So it's really uncomfortable. It's not an enjoyable test. Oftentimes there's a lot of promotion around Breast Health Month in October. And so people try to get their mammograms, and then you're waiting for months to get a mammogram. And then things come up, life happens. Look, I was delayed too, right? In getting my mammogram by a couple months. And so it happens. And breast cancer, my mom had breast cancer, as I mentioned. And so I was on high alert. I had already gotten genetic screening before. There was no obvious genetic component in the screening, but that doesn't mean there's no genetic component to breast cancer. 1 in 8, or I think it's almost 1 in 6 now, women will have breast cancer in their lifetime. So it is extremely common. And so the earlier you catch it, the better you are. I have since talked to many, many women who have gone through breast cancer treatment, and the treatments are very variable, and the outcomes are very variable. And so I had a very good friend, his wife died in her 30s of metastatic breast cancer with 2 small children. And so I really hope that you're watching this, and if you haven't booked your mammogram, or if your wife or your sister or your mother or your daughter hasn't gotten their mammogram screening and they're above 40, or if they have risk factors and they're below 40, like 10 years before their first degree relative was diagnosed, if they have BRCA genes, if there's other high risk concerns in your primary care, can go over those with you to make sure that you get screened. Because I'm fortunate that it was caught at a smaller size. Now, I don't know what what is going to sort of come in the future, but I'm hopeful that we caught it early. And then for the colorectal cancer, again, as I mentioned, I've talked to so many people about colorectal cancer in the last few weeks, and the incidence of colorectal cancer in young people is increasing. Now, some of that is diet and exercise, right? We have more highly processed diets. People exercise less. But even more than that, like there's exposures in the environment. I talk about those, and we just don't know enough, right? About how those really affect our bodies. They're finding microplastics in testicles. They're finding microplastics in semen. And so we don't really know what that's doing to our bodies. People are eating less fiber, and fiber is protective for colon cancer. So I really, do yourselves a favor, start fixing your diet and exercise as best as possible. Try to do things that are easy in your environment, like avoid plastics, try to minimize processed foods, cook at home. And if you eat out, make sure that food is healthy, not fried foods, not highly saturated fat, because that really can make an impact. And so, again, if you're 45, you should be getting colorectal cancer screening. Generally, that's a colonoscopy. And what we learned during this process was that only half of adults get colorectal cancer screening, only half. So I think that absolutely it is a pain. The prep is not easy. It is uncomfortable to take the prep and go to the bathroom a million times and feel uncomfortable for 24 hours. But it is absolutely worth it to get and analyze. And there are other ways, right? You can do other tests to screen for colorectal cancer that don't require colonoscopy, but a colonoscopy is the only way to identify polyps and remove them all at the same time. So it is sort of preventative. And I talked about that on my podcast with Dr. Trisha Pasricha. And I've talked to multiple gastroenterologists on this podcast, Dr. Will Bulshwitz, Dr. Kumkum Patel. You can watch those podcasts. We've talked about it ad nauseum. I will say that the one thing, when I first got diagnosed as someone who cares deeply about hormonal health, I was very concerned about what going through this treatment was going to do for my hormonal health. And it remains to be seen. There is certain times where it is absolutely contraindicated to be on hormones, and that's right now for me. And then in the future, we will see as the data evolves. But I think ultimately, it's not ideal. And I feel for my patients with prostate cancer who end up going on things like Lupron, which totally destroy their testosterone, and they feel pretty miserable while they're on it. And I am not looking forward to being on either tamoxifen or a medication like Lupron, but I will do what I have to do to live. Anyways, I will take some questions. I'm going to look at the questions now. Thank you guys for joining me. J3LL1S, amazing. You had your colonoscopy at 45. So happy for you. Yes, colonoscopy is absolutely not the worst thing. God, this is such a sweet, sweet chat. Like, you guys are so wonderful and and supportive. I'm really blessed to have you guys. And I want to reassure you, there's still going to be content here. I pre-made content. I think I mentioned I'm having surgery tomorrow, but I've pre-planned content for the whole month, and I will continue making content. If you want to support me, the best way to support me